Chapter 7, Other Addictions and Other Drugs. We're going to cover lots of interesting things. Maybe. There we go. Okay. Other drugs, inhalants, volatile liquids, aerosol sprays, gases that come in pressurized tanks. These substances have many of the same psychoactive effects of street drugs, and that's what makes them popular. Sports drugs, natural and synthetic substances, they accelerate the healing of injuries. We're specifically talking about PEDs like growth hormone and steroid. It increases your performance because you can work out more and heal faster. It alters the state of the athlete's consciousness. Really interesting stuff. Hard to classify drugs, animal extracts, herbal preparations, smart drugs, and drinks. Nootropics, they've been used for their psychoactive effects. They've been used to improve mental health. They've been used to improve physical health. Inhalants are used because the user finds it stupefying, intoxicating, occasionally psychedelic. There are three main groups of inhalants: volatile solvents and aerosols, volatile nitrites, and anesthetics. Most of the volatile solvents and aerosols are synthesized from petroleum and mixed with other chemicals. Hydrocarbons are found in glues, gasoline, nail polish remover. Many aerosols are inhaled for their propellants rather than their ascribed contents. Other volatile organic compounds include esters, ketones, alcohols, and glycols. The volatile nitrites include butyl and amyl nitrites. These drugs are used as vasodilators for people with heart problems. They've also been used in air fresheners. Illicitly, they're used recreationally at parties, but especially in sexual situations. And we're going to talk about that in just a second. Anesthetics are used to block pain or induce unconsciousness for medical procedures. Nitrous oxide is used in dentistry for anxious patients who do not wish to use Novocaine. Also called laughing gas, it is not uncommonly used at parties to induce giddiness and euphoria. The most widely used inhalants are nitrous oxide, nitrites, gasoline, glue, spray paint, aerosol sprays, lacquer thinner, and correction fluid. Inhalants are sought because they are quick acting with intense effects. They enter the bloodstream within 7 to 10 seconds and may last from a few minutes to an hour. They are cheap, readily available, and widespread. There are more than 1,500 chemical products that can be inhaled for their psychoactive effects. They're readily accessible to children and adolescents, as many exist in any garage or home. They have more direct toxic effects on body tissue. There is a lack of awareness of inhalants as drug problems, and for that reason, kids are getting away with huffing. Inhalant abuse is most prevalent among adolescents. Inhalants account for from 700 to 1,200 deaths in the United States per year. This is a worldwide problem as cheap highs are sought by the young, the poor, street children, recent migrants to cities, indigenous peoples, and children of parents who work at home with volatile chemicals. The inhalant of choice in many poor countries is gasoline because it is readily available. Inhalants are most likely abused by 12 to 17-year-olds and more females than males. This problem was especially serious in the 1990s, but has since dissipated. American Indian and white adolescents are more likely to use inhalants than blacks or Asians. There are 7 methods of using: sniffing, breathing in the inhalant through the nose directly from the container; huffing, soaking material and putting the material over the mouth and nose; bagging, soaking material and placing the material in a bag to be inhaled through the nose or mouth; spraying the inhalant directly into the nose or mouth; balloons and crackers, punching a can of inhalant and capturing it in a balloon for inhaling; masking, spraying an aerosol in a bag and then putting the bag over the head. Or you can just put it on your clothing and breathe it. It will get to your nose that way. Volatile solvents are carbon and hydrocarbon-based compounds that turn to gas at room temperature. Gasoline additives, paints, especially metallic paints, kerosene, air dusters, paint thinners, lacquers, nail polish remover, spot removers, glues and plastic cements, and lighter fluid. Volatile solvents are absorbed very rapidly into the blood and move to the heart, brain, and liver within 7 to 10 seconds. It gives you temporary stimulation, gives you an elevated mood, it reduces inhibitions, it increases your impulsiveness, it's exciting, it causes irritability, dizziness, slurred speech, unsteady gait, and drowsiness. These inhalants are exhaled by the lungs and excreted by your kidneys. After prolonged inhalation, the user may experience delirium with confusion, psychomotor clumsiness, emotional instability, impaired thinking, or potentially coma. You may go into a coma. Long-term effects of inhalant use, arrhythmias and myocarditis. Myocarditis is where the covering of your heart becomes infected, as nice as that is. Pulmonary hypertension, respiratory distress, and lowered breathing capacity. Liver toxicity. Carboxyhemoglobin may cause brain damage. Some inhalants may cause neonatal growth retardation. Odd facial features and tremors in newborns. While most huffers move on to other drugs, those who stay with inhalants can expect some fairly debilitating effects. Poor coordination characteristics, inability to concentrate, weakness, disorientation, weight loss, memory loss due to hippocampal interference, poor problem-solving skills, difficulty controlling one's behavior, blood irregularities, and potentially chromosomal damage. Chronic huffers tend to have antisocial personality disorder, but it is not sure whether the huffing causes the behavior or the environment that the individual was raised in. These individuals also tend to use whatever drugs they come across. The most widely abused substance is Toluene Methylbenzene because it is such a good accelerant and is in so many products. It's in glue, drying agents, solvents, thinners, paints, inks, and cleaning agents. 65% of chronic abusers of Toluene have neurological damage, which is not very good. Trichlorethylene, or TCE, is another common solvent found in substances used for huffing. That's in your correction fluid. That's one of the reasons why you can only buy one bottle of whiteout at a time. Paints, metal degreasers, spot removers, extracting oils and fats from vegetables. It causes depression and moderate hallucinations. If used heavily, it can cause neuropathy. Some of these neuropathies can be permanent. N-hexane and methylbutyl ketone, MBK, are solvents used for glues, solvents used for adhesives, diluents for plastics, diluents for rubber, in the production of laminated products, as a paint thinner, as a solvent for dyes. H-hexane and MBK have been shown to cause neurological damage, especially in the brain. Recovery can take up to 3 years. Small molecule alkanes are gaseous at room temperature and cause cardiac arrhythmias and sudden death and include methane, ethane, butane, and propane. Large molecule alkanes are also neurotoxic and include hexane and pentane. Gasoline is readily available and used as an inhalant, especially on American Indian reservations, the effect only lasting for 3 to 5 minutes. Not only are the hydrocarbons neurotoxic, but the solvents, metals, and additives can cause problems as well. Insomnia, tremors, anorexia, paralysis, lead poisoning causes brain damage, liver damage, bone marrow damage, kidney damage, and lung damage. Residual effect might last for 5 to 6 hours. Over half of all inhalant deaths are due to gasoline inhaling. And I mentioned the fact that this is prevalent on American Indian reservations. The reality is it's not so prevalent in the South. It's not nearly as prevalent in the Southwest as it is on the Northern Plains. North Dakota, South Dakota, Montana, and Washington State. It's relatively common up there. Probably too common than it should be. Alcohols are the most frequently abused inhalant solvents: methanol, ethanol, and isopropanol. When inhaled, alcohols can produce a mild high along with nausea, vertigo, weakness, vomiting, headaches, and abdominal cramping. Sounds like fun. Sounds like the flu. For ER personnel, it is important to know the warning signs of solvent abuse. This is one of the things that I noticed when working in the emergency room. And of course, I haven't been in the emergency room for 30 or 40 years. 30 years. Yeah, 32 years. Headaches, chemical odor on the body or clothes, red, glassy, or watery eyes. This is something you don't forget. Red, glassy, or watery eyes with dilated pupils, nosebleeds, inflamed nose, rashes around nose or mouth, slow, thick, or slurred speech, staggering gait, disorientation, lack of coordination, pains in the chest and stomach, fatigue, nausea, shortness of breath, loss of appetite, intoxication, of course, irritability and aggression, seizure, and sometimes coma. Um, Usually they bring them in for a reason, and usually has to do with the last two. Usually they've gone through a seizure and now they're wanting us to make sure they don't die. I've only seen one person come in with a coma from inhaling anything, but you know, I worked in medicine for 30 years. Wasn't that fun? Nitrites have been used as medicines, especially heart stimulators for angina. Angina is merely a Latin phrase for chest pain. That's all it is. But angina has to do with your usually a heart arrhythmia, and so you got to get the heart back in rhythm. It's been used for heart problems since the 19th century. Alkyl nitrate, isomal nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, and cyclohexyl nitrite are the nitrites. Nitrates dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning. It takes 7 to 10 seconds for the effects to take place, which is a good thing because you need to get that heart going. You need to get it back in rhythm as quickly as possible. It can last for up to 60 to 70 seconds. The blood pressure lowers and hits its apogee at 30 seconds and returns to normal at 90 seconds. Nitrites are sometimes called poppers. That's not by the people with the angina attacks. They don't call them poppers. It has to do with sexuality, and we're going to get to that in just a second. Nitrites cause a feeling of fullness in the head, a rush, a mild euphoria, dizziness, and giddiness. As the inhalant burns off, they might experience headache, nausea, vomiting, and chills. Now remember, it lowers your blood pressure. And as soon as your blood pressure returns to normal, that's why it causes the headache and the nausea. If you're not used to holding your stomach contents from the nausea, you will vomit, and the chills are because of the rush of blood into your system, the blood pressure going back to normal. Excessive abuse may cause oxygen deprivation, fainting or passing out, and temporary asphyxiation. Overdoses do occur and necessitate taking the victim away from the nitrate. That's all you have to do. Usually you don't have to perform CPR, but it does happen. Normally we don't get those guys. already gone, and we get them in the morgue, unfortunately, because if they have this kind of reaction and nobody's done anything about it, then they usually don't make it. Chronic users will have a reduced oxygen carrying capacity due to methemoglobin. Nitrates are used to enhance sexual activity by increasing blood flow to sexual parts and relaxation of smooth muscles. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. Unfortunately, nitrates impair the immune system by inhibiting the functioning of white cells. Nitrates also convert to nitrosamines, which are cancer-causing chemicals. So they use it for anal intercourse. This is very popular among gay males. So this is one of the reasons why we talk about it. Poppers, when used with Viagra, cause lowered blood pressure in users since both medications lower the blood pressure. When these two drugs are used with methamphetamine, people have been known to faint or even die. Volatile nitrate abusers are notorious for multiple drug use. 2/3 use at least 3 other inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. Anesthetics are used to slow the central nervous system and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be abused was nitrous oxide. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects. Nitrous oxide is sold in small plastic canisters to be used in cooking, and I will show you. Oh, I guess I won't. Nitrous oxide's effects include dizziness, giddiness, and disorientation, silly laughter, buzzing and throbbing in the ears, visual hallucinations, confusion and headache, feeling that one is about to pass out, impaired motor skills and fainting. The effects only last for 2 to 3 minutes. Cognitive functioning is impaired with the drug, but returns to normal after 5 minutes. Long-term exposure can cause peripheral and central nerve cell damage due to the lack of oxygen. Nitrous oxide replaces oxygen in the blood. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and legs, cardiac arrhythmias, asphyxia, seizures, and death. Halothane is rarely used in the West. It is widely used in third world countries because it is inexpensive and works very rapidly. This anesthetic is used primarily in veterinary procedures. It is most frequently abused by hospital personnel. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross tolerance to other depressants, especially alcohol if used chronically. Inhalants are seen as low class among the drug using community. 3 categories of drugs are used in sports. Therapeutic drugs used for specific medical problems and administered through proper medical supervision. Analgesics, muscle relaxants, anti-inflammatories, and asthma medication. Ergogenic drugs, performance-enhancing drugs, include steroids, human growth hormone, blood doping, and stimulants. Recreational and mood-altering drugs. There are also recreational mood-altering drugs. We've talked about most of them before. Athletes use drugs because they perceive drugs as a quick way to put on pounds and muscle, increase stamina, and get up for a game, relieve pain, and keep up with other athletes who use drugs. And this was the excuse for the steroid era. The hitters were saying that the reason that they were using steroids is because the pitchers were using steroids, and the only way to stay up with the pitchers was to use steroids as well. It just wasn't fair. Analgesics and anesthetics are used to deaden pain and include both topical and oral analgesics. The topical analgesics include the alcohols, ethanol and methanol, procaine and lidocaine. where was I? I was playing softball, and the doctor suggested that my knee was sore, and the doctor suggested that instead of doing anything else like injecting cortisone, that he would just put lidocaine on it. Then I couldn't feel it, and I thought, well, that's kind of stupid. I don't really want that to happen. I need to know. I need to know when my knee is in the wrong position and hurting. So I declined, but he was going to give me lidocaine. Um, that's the topical. The oral analgesics include aspirin, ibuprofen, acetaminophen, which is another name for Tylenol. Hydrocodone, of course, is an opioid. It's another name for Vicodin. Meperidine, which is another name for Demerol, morphine, codeine, and Darvon, or propoxyphene. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. And if you take away the pain, then you don't know when you're actually hurting yourself. It can be a dumb thing. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. They include opredol, that I always knew as Soma, or Vanadom, methylcarbamol, Robaxin, which is very common. The benzodiazepines, diazepam, which is also Valium, clonazepine, which is Klonopin, and chlordiazepoxide, which is Librium. Librium and Valium, of course, were very popular during the Vietnam War to sedate soldiers' wives who were overseas. The men were overseas, of course, and the soldiers' wives were back here worried about whether they'd come back from Vietnam. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two classes, non-steroidal anti-inflammatory drugs, or the NSAIDs, and then the corticosteroids. The NSAIDs include aspirin, ibuprofen, indocin, butazolidine, Clonoril, and Celebrex are the NSAIDs. The corticosteroids include prednisone and cortisone. My wife was taking prednisone for some kind of pain. I can't remember. Both types of anti-inflammatories have their problems. NSAIDs, aspirin, and ibuprofen cause ulcers and kidney problems. Celebrex is only recommended for arthritis and may cause heart and gastrointestinal problems. Tylenol is hard on your kidneys, on your liver. Corticosteroids can cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, psychosis at high doses. So you need to be careful with corticosteroids. Asthma medications open air passages. 10% of the general population has asthma. That's a lot of people with asthma. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. Most asthma medications used by athletes are beta-2 agonists, such as clenbuterol, which you're not supposed to take if you're competing, and albuterol. These medications increase muscle energy and growth, and you can imagine why people want to take them. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, erythropoietin. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemia, some breast cancers, and endometriosis, which is what my sister had endometriosis. She had a hysterectomy, and they left some of the endometrium inside her. It became cancerous, and that's why she died. She died of endometrial cancer from a botched hysterectomy, as sad as that is. When athletes take steroids, they experience increased body weight, lean muscle mass, muscular strength, stamina, aggressiveness, and confidence. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage. Anabolic steroids users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% use 7 or more steroids at a time. There was a baseball player who played for Boston. He played for Los Angeles. The guy's name was Manny Ramirez. And he was a steroid user. And what he would do, he would mask it with estrogen. So he would take estrogen to mask the excessive amount of testosterone. Theoretically, it balanced it. And they didn't catch him for steroid use. They caught him for estrogen use, which is, backwards kind of. Anyway, he was banned from baseball for a while, and then he came back, and he wasn't as good because he couldn't pump himself up with his steroids. So he dropped out of baseball. But my daughter was working with somebody that worked with Manny Ramirez. He was an exercise physiologist. And the guy was a little shady. And I told my daughter that when I first met him. This guy's kind of shady. I don't know if you should be dating this fellow. And not because I said anything about it, but because she detected the same thing. She dumped the guy. Immediate effects of steroid use is increased muscle mass and improved muscle tone. Having muscles too large and strong for the bone and tendon structure may cause an overstressing of the muscle, which ruptures your tendons, and it damages your ligaments. And then they have to have surgery to reattach the muscle to the bone, to reattach the tendons and the ligaments. And it causes a lot of trouble. Users often complain of feeling bloated. That's because of water retention. Anabolic steroids suppress the natural production of testosterone. It enlarges the individual's breasts. It causes nipple changes. And when we're talking about nipple changes, you get fatty lipomas behind them, which makes your nipples look puffy. It decreases the size of your sexual organs. So if you're a male, of course, that means that your penis shrinks and your testicles shrink. Impaired sexual function, cystic acne growth, thinning hair, and more rapid balding. There you go. I think maybe he's on steroids. Female athletes also use anabolic steroids for muscle growth and other masculinizing effects, though some are unwanted. Increased facial hair, which is always attractive when a woman has a beard, decreased breast size, lowered voice, clitoral enlargement, cystic acne once again. It's usually on the back, by the way, and thinning hair, not just for women, but for men as well. Most of these masculinizing effects are irreversible. I had a friend who, let's see, how could I say this? This was a friend of my daughter's, actually, and he would wear, I just wear a cutoff shirt when I lift because I can't stand to have my shoulders constricted while I'm trying to lift. But he would wear a sweatshirt. And you're wondering, what in the world is this guy doing? Why in the world is he wearing a sweatshirt? It's 80 degrees in here, and he's got a sweatshirt on. What's going on? Well, what was going on was the fact that he had cystic acne growth on his back and his chest. And he didn't want anybody to know. Most of these masculinizing effects are irreversible. So once it starts, you can't stop it. And there's a young lady who's a bodybuilder with all of her blood vessels sticking out. Anabolic steroids increase the cholesterol of the user, especially the bad stuff, the LDL. At the same time, steroids lower the good cholesterol, or the HDL. Steroid users have an uncommon amount of cardiovascular problems, hypertension, thrombosis, cardiomyopathy. Uh, because steroids encourage cell growth, they may equally encourage cancer cell growth, and that's never good. Anabolic steroids do have an impact on the user's mental state, at first supporting more aggressive and confident behavior. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, to depression, to psychotic symptoms, to paranoia. Psychotic symptoms to paranoia. This emotional cycling is known as roid rage and is more pronounced in individuals who have anger issues to begin with. While some people report a slight euphoria when taking anabolic steroids, it is thought by researchers that this is due to anticipation of intense activity rather than actual addiction. Some users do report withdrawal symptoms, and in fact, some users will use low doses during cycling to maintain their sanity. There is some animal study evidence that steroid use is addictive. Stimulants are taken by athletes to make them more alert, to make them feel more confident, and to make them stronger. Much of the increase in ability when taking amphetamines is increased focus and aggressiveness. Heavy usage can lead to blood pressure problems, exhaustion, and malnutrition. Caffeine is a mild stimulant used by some athletes. At low doses, it increases wakefulness, mental alertness, it slightly increases your endurance, your muscle contraction, digestive disturbances, and urine output causing dehydration. Ephedra, also known as mahuang, and ephedrine are mild stimulants used by some athletes. These substances were found in many over-the-counter medicines. Not everyone is sensitive to these medications, but to those who are, they cause jitteriness, anxiety, headaches, high blood pressure, cardiac arrhythmias, poor digestion, and overheating. Chewing tobacco used to be a mainstay in Major League Baseball parks. From the beginning of baseball until into the 1980s, many, if not most, baseball players maintained a chaw of tobacco in their cheeks almost constantly during a game. Many baseball icons of the past died of throat or esophageal cancer. It is rarely seen today because it is banned in most baseball parks. And there you go. There's two guys that do it, or that did it. Nellie Fox has died of throat cancer. Nellie Fox was the second baseman for the Chicago White Sox. They won the 1959 American League pennant, and then they lost to the Dodgers. But his double playmate was Louis Aparicio. And this is Pablo Sandoval. Used to play for Boston. He played for the Giants twice, but he dips snuff, and he spits a lot. He's not playing right now. I don't think he's playing right now. He played for the Braves last year, I think, when they won the World Series. Human growth hormone is hormone produced by the pituitary gland to stimulate growth in children. It is prescribed for children who are of unusually small stature to stimulate growth, and for people with wasting diseases like AIDS to build strength. It is used by athletes because it increases your muscle mass, it thickens your skin. Connective muscles connective tissue in the muscles, acromegaly, cardiovascular disease, decreased sexual desire, goiter, and menstrual bodies and impotence. Decreases your lifespan up to 20 years. Okay, there you go. That's what acromegaly looks like. As you can see, it's an elongated face. If you see somebody with acromegaly, they probably have Marfan syndrome, potentially. If they're really tall, they have long arms and long fingers, along with the small ear and the elongated chin. Androstenedione, also known as andro, and dihydroepiandrosterone, DHEA, are natural hormone precursors to testosterone. Neither of these supplements have been found to do more than increase testosterone levels in men with abnormally low testosterone levels. But what if you don't have abnormally low testosterone levels? It doesn't do anything to you. They also seem to increase HDLs and female hormone estradiol. DHEA has been known to reduce stress, as interesting as that is. Beta blockers are medications prescribed to lower your blood pressure, to decrease your heart rate, to prevent arrhythmias, to reduce eye pressure. They work by blocking adrenaline from exciting the heart. They also calm the individual by blocking nerve cells in the brain. Beta blockers are used by athletes who require precision and concentration, like archers, participants in rifle shooting competitions, ski jumpers, and drivers. Beta blockers do have their problems as they cause fatigue, lethargy, dangerously low blood pressure, gastritis, occasional nausea, vomiting, temporary impotence. It may intensify asthma. It may intensify heart problems that may kill the user. Erythropoietin, also known as EPO, is a medication that is given to individuals to promote red blood cell production. It is often given to individuals who are going through chemotherapy to induce their bone marrow to produce replacement RBCs due to their problem. EPO is used by athletes to increase stamina, though this unnatural thickening of the blood can lead to blood clots, which in turn might lead to strokes or heart attacks. When my sister was on chemotherapy, they would have her come into the clinic for when her blood count was low. They'd have her come into the clinic and they'd give her erythropoietin. And like the next day, she's feeling much, much better because she had started producing more and more red blood cells because of the EPO. A similar problem is blood doping, where the athlete stores their own blood prior to competition and then are administered the packed red blood cells to increase the stamina of the individual. Packed red blood cells means instead of getting all the serum fluid, all the liquid, they pull that part out and just give you a little bit of liquid and a lot of cells. The technique is used in endurance sports, cycling, long distance running, and cross-country skiing. Athletes will use just about any substance that will give them a competitive edge. Herbs, animal extracts, vitamins, minerals, proteins. Unfortunately, some of these items may contain banned chemicals and cause the athlete a great deal of trouble. One dietary supplement used by athletes is creatine. Creatine is an amino acid that occurs naturally in the human body, as well as in fish and meats. Creatine is used because it delays muscle fatigue. It stores energy that can be used in short bursts. It extends the amount of time a person can work out. It helps muscles recover faster. Problems come when it is overused. It causes dehydration, stomach cramps, nausea and diarrhea, muscle pulls and strains, and kidney problems. Gamma hydroxybutyrate, or GHB, was used in the 1980s and early 1990s as a fat burner, an anabolic steroid, sleep aid, muscle definer, plant growth supplement, and psychedelic. Picked up by sexual predators as a date rape drug, it is now only used legally as a medication for muscle weakness. GHB. Some athletes will consume sodium bicarbonate 30 minutes prior to exercising to decrease the development of acidosis. This works for shorter events that take place within 10 minutes, but no longer for endurance events. It can cause diarrhea and water retention. Okay. Why do I have this? Wait a minute. Oh, I can't do that. Wait a second. I'm being goofy, huh? There you go. Let's see what this is. It may not be there. Okay. My goodness. Oops, there you go. No more plastic surgery. I can't remember why I put that in there. Anyway. Now we already talked about sodium bicarbonate. Okay. Athletes trying to make weight will resort to various techniques to drop unwanted pounds. This is wrestlers mostly. Diuretics, laxatives, exercise, fasting, self-induced vomiting, excessive sweating in the sauna, and use of stimulants. Some athletes will lose 3 to 5% of their body weight in a couple days, and this is primarily, like I said, wrestlers, but also boxers have to make weight. And, well, anyway. Anorexia and bulimia are not uncommon among athletes who are potentially trying to make unrealistic weight levels. Another problem with weight maintenance is the opposite of anorexia, which is muscle dysmorphia, where the individual becomes obsessed with muscle development as they see themselves as too weak whenever they look in the mirror. These individuals are more likely to take copious supplements and steroids to combat their body's weakness. Now, let me see if this one works. Pig jockey. I guess I should have looked at this before the lecture. Let's see if this one works. Not found. Okay. All right. All right. Well, these were goofy things anyway. There we go. Athletes will often use diuretics to lose weight rapidly, to limit the bloating caused by steroids, by sucking the water out of their system to avoid detection of illegal drugs, to lose weight to look thinner. Athletes need to monitor their use of diuretics because of the possibility of dehydration, leading to heat stroke and organ damage. Speaking of this, I don't know if you saw the movie Baywatch, but in that movie, Zac Efron was ripped. He was really ripped. And I have read accounts of what he had to go through in order to look that way. He went through this horrible weightlifting regimen. And then just before they shot those scenes, one of the things that you do in order to look that ripped, bodybuilders, one of the reasons bodybuilders look the way that they do, wait a minute, if we can find him. There we go. One of the reasons they look like that is because they take diuretics and they draw all the water out of their skin, and it just leaves the muscle in the skin, and there's no water underneath. Normally, if you make a muscle like you you're looking at your bicep. This is your bicep right here. This is your tricep. If you look at, or your, this is your deltoid. If you look at your deltoid, I mean, it doesn't look like that. It can't look like that unless you're dehydrated, and that's what they do. And so they do this for competition, so that they will look even stronger. This is really destructive, especially for your kidneys. And that's what happened with Zac Efron. He said that after that movie, it took him 6 months to recover from just making it, not from the bodybuilding aspect. It didn't have anything else to do with the movie. It was the fact that he had to do that in order to look that good. And you can look at that online if you want to. Zac Efron. I've already done creatine, athletes trying, anorexia and bulimia. Okay. Weightlifters will take adrenaline supplements combined with amyl and isobutyl nitrite to increase their strength. It unfortunately can cause dizziness, rapid heartbeat, and hypertension. The weightlifters we're talking about here are power lifters. Power lifters try to lift as much weight as they possibly can. A lot of times they do damage to their joints. When they use this stuff, they can actually lift more weight. And of course, that's okay as long as your body can handle it. But a lot of times it can't. It causes all kinds of interesting problems. I went to high school with a kid that was with a couple of kids that were power lifters, but one of them he's taken so many steroids and so much supplements that he's barely functional now, and he's younger than I am. He's my brother's age, so I'm 73, so he's probably 71, and he's not going to be around much longer. Because of some of the things he did just to power lift. He holds a ton of records, but what good are records when you're dead? Some athletes will take calcium pangamate as a supplement. This chemical combination is sometimes referred to as vitamin B15 and pangamic acid. It is reputed to keep muscle tissue better oxygenated, though there is no scientific research to back up the claim. This substance is known as a carcinogen, and I don't have a picture of it. Wait a minute. Okay. Cyproheptadine or periactin is reputed to be a steroid like bodybuilder, and has been used to increase body weight and muscle strength. This drug is an antihistamine. It acts as a serotonin and histamine antagonist and increases muscle mass and strength by making the individual hungry. It actually merely increases the user's appetite and has the added side effects of decreased performance, sweating, and sedation. Drabopoetin aranesp is a medication developed to treat chronic anemia. Just like erythropoietin, the drug increases RBCs and thus the oxygen carrying capacity of the athlete's blood. Human chorionic gonadotropin is the substance produced by fetuses to protect themselves from their mother's immune system. HCG, along with clomiphene or tamoxifen, is taken by steroid users to restart their own body's testosterone production. This substance also blocks increased effects of estrogen in the male body. The drug can have an impact on the liver and reproductive system. Modafinil Provigil acts as a stimulant and is used to treat narcolepsy. Athletes using the steroid THG will take the drug to mask the steroid. Orethine and arginine are amino acids taken to increase muscle mass because it is reputed that they cause an abnormal release of HGH, human growth hormone. Primogen is used in Europe to facilitate the release of steroids in the body. Vitamin B12 is used to ward off illnesses and provide extra energy. We used to give people vitamin B12 shots all the time when I lived in when I lived in Oklahoma and I was working in a rural health clinic. It can also be used to speed the recovery from a hangover, and that's primarily what I was giving people shots for. People, lawyers or somebody, they would just come in and they talk to the doctor. And he'd order them a vitamin B12 shot because they were so hungover. Anyway, the things you see when you work in medicine. As has been seen, athletes will do just about anything and take just about anything to improve their performance on the athletic field. Athletes will use stimulants to boost their performance, from innocuous caffeine and tobacco to the more destructive amphetamines. Athletes will use sedative hypnotics, especially Xanax, to unwind from the stresses of competition. Sometimes these drugs are used to counteract the stimulants that they have taken to perform. The most widely used depressant by athletes is alcohol. While in low doses, the substance does not hinder performance. In most cases, alcohol is used as a reward for performance, as a way to unwind, or as a consolation after a disappointment. Marijuana is contraindicated for performance, though when used in the right mood might actually improve performance. Marijuana doesn't help athletes because it lowers your blood pressure, causing fainting during competition. It inhibits sweating, which might lead to heat prostration during exercise. It decreases tracking ability. Oh, God, it does. Oh, we were playing this one softball team one night. It was a 24-hour tournament, which meant that you played all for 24 straight hours. I mean, it was crazy. And we were playing this one. It was a mixed league, so it was co-ed. So we were playing this one team, and they were pretty good. They were in the winners bracket, and we were in the winners bracket, and their men were really really good, and their women were pretty good too. Their women were really good. What am I talking about? They were better than the men. But so what happened was we got them about 3 o'clock in the morning, and evidently they'd been smoking a little bit too much weed, and we weren't supposed to win. They had been killing just everybody, and evidently they decided to go out and celebrate. And it's 3 o'clock in the morning, and it was a 3-2 tournament, so you only got one pitch, and they were striking out, and they could barely find the ball. I mean, it was really really silly, and I was the pitcher. It was all they needed to do was take the pitch half the time. But they swung at everything. But it was worse when they got out in the field because they couldn't catch the ball. I mean, this one girl got hit right in the face. She was playing shortstop, and it was a line drive right at her. She almost got her glove up in time, but it popped off the end of her glove and hit her right in the nose, broke her nose. They forfeited after that. She was their shortstop. Anyway, not important. It just decreases your tracking ability. And her problem was, and it wasn't like shouldn't have caught it. It was like, come on, you can get that glove up there a little bit farther. She just couldn't track the ball, and you could see her head kind of moving with the ball, but it wasn't moving fast enough. It hinders the ability to do complex tasks like catching a softball. Diminished hand-eye coordination, as we just talked about. It decreases oxygen intake. It is a banned substance by the NCAA, and of course, it's illegal in 20 out of 50 states. But now it's not. They're not arresting people for marijuana use, because marijuana is fat soluble. It continues to impair 1 to 2 days after use. So these guys. They were in the winners bracket, like I said. They were supposed to win the whole tournament. But what happened was that we knocked them out, and they forfeited the rest of the game, and they forfeited the next game, and they were out of the tournament. There are no limits to what people will do to get high. People have been known to smoke aspirin, to chew dandelion roots, to drink gasoline. Individuals have been known to mix gasoline with orange juice to make a barely palatable concoction known as Montana gin, to drink rubbing alcohol, which is poison, of course, to drink hydrogen peroxide, which isn't poison, but I can't imagine it tastes very good, to put Anbesol, which is a topical anesthetic, into your eye, and to smoke toad secretions. Mortuaries have had to watch their supplies of the fluid they use to embalm bodies, formaldehyde. Remember, acetaldehyde is almost the same thing as formaldehyde. Alcohol breaks down into acetaldehyde in your stomach. So they're just skipping a step and going right to formaldehyde. When inhaled, this substance acts as a depressant and a psychedelic, but it can also be used to manufacture illicit drugs. When mixed with marijuana, the substance provides a PCP-like effect and is called clickers, clickums, fry, wet, or illy. I-L-L-Y, illy. Raid, Lysol, and any hairspray are sometimes used for their alcohol content. Raid has been used to spray on marijuana to intensify the effects of the marijuana in a concoction known as Cannade. Cannabis, Raid, get it? Kava is a plant found in the South Pacific and South America. The root is crushed and a milky white exudate is extracted, which is drunk like alcohol. The drink is reputed to have similar effects as alcohol and acts as an anti-anxiety drug. It is said to have an unpleasant flavor and numbs the tongue and lips because it's made with human saliva in its preparation. So you spit in this stuff, and then and the bacteria from your spit ferments this white exudate, and that is the kava. In some Arab countries, camels are force-fed marijuana. After going through the digestive process, the camel dung is smoked for its hashish content. The bufo genus of toads produces a psychedelic substance from its pores as a defense mechanism from attack. The toads are sometimes milked, and the resulting substance is smeared on cigarettes and smoked for the psychedelic effect. Bufo genus, and those are found in the Sonora Desert. All natural medications started out as herbal preparations concocted by shamans, medicine men, wizards, or physicians. Some of these herbs merely had a placebo effect, while others have been proven to contain chemical structures that have great benefits for mankind. A good example of that is quinine, which is developed from the cinchona tree to fight malaria. The search for the fountain of youth are merely drugs that will help the individual recover from a hard night of drinking, have recently come to the fore as smart drugs and nootropics. Smart drugs, drinks, and nootropics are drugs, nutrients, vitamins, extracts, herbal potions such as ginseng, ginkgo biloba, and caffeine, and amino acids. And just a disclosure, I take ginseng, ginkgo, and right now I'm drinking a Mountain Dew, which has a lot of caffeine in it. But I'm not sensitive to caffeine. But I do take ginseng and ginkgo biloba every day to increase the blood flow in my brain, to make me smart. Isn't that what it says? Smart drugs and drinks. There we go. These drugs are reputed to boost intelligence, to improve your memory, to sharpen your attention, to increase concentration, to detoxify the body, to energize the user, and reverse the aging process. And I can tell you at 73, it hasn't reversed my aging process, I assume. New age smart drugs or nootropics include hydrogene, selagelene, vasopressin, 5-HT, which is serotonin, modafinil, paracetam, oxyracetam, which improves your learning, improves your memory consolidation, and theoretically improves memory retrieval. Compulsive disorders are repetitive behaviors that the individual appears not to have any control over. They come in two categories: impulse control disorders and compulsive disorders that have their own classification. Impulse control disorders include compulsive gambling and hair pulling. Compulsive disorders that have their own classification: overeating, shopping, sexual behavior, internet use, watching television, pathological lying, shoplifting, and fire setting. Impulse control disorders are actions that may be pleasurable in the beginning, but as the attempt to resist the impulse continues, becomes harmful to the individual or others. This disorder also has accompanying tension or arousal before the act is committed. After culmination of the act, the individual often feels gratification, pleasure, relief, and then possibly remorse and guilt for not controlling the behavior. Obsessive-compulsive disorder is a repetitive activity where the goal is to reduce anxiety or distress caused by obsessive thoughts. The goal is rarely to provide pleasure or gratification and include compulsive hand-washing, checking things, ordering, counting, and praying. Compulsive behaviors are engaged in for the same reasons people compulsively use addictive drugs. Wait a second, I need to write something down. Sorry. Instant rush, forget problems, control anxiety, oblige friends, self-medicate. These individuals are trying to alter their mood and change their state of consciousness. MRIs show that the same areas of the brain are activated when compulsive behavior is done as when drug use is anticipated or done. Drug users are compulsive about their drug use. Compulsive gamblers gamble compulsively. The drug user develops a tolerance for their drug. It increases the bet amount when gambling compulsively, that they build up a tolerance. Have withdrawal symptoms after abstinence. They become restless when not gambling, withdrawal. They continue to use despite adverse consequences. They continue gambling until they have used all their money, abuse. They are in denial about their usage. Compulsive gamblers think they control their gambling and refuse to see the consequences. They're in denial as well. They have a strong tendency to relapse. They will relapse whenever they have money again. I had a friend who was an alcoholic for about 12 years. Eventually, he stopped drinking and he kept going to AA. But what he did, he replaced it with compulsive gambling. So he had an addictive personality. He had to do something addictively. And so, but I guess gambling isn't going to kill him. Well, probably. It's not going to kill him like alcohol will. One telling sign is that organizations like Gamblers Anonymous and Overeaters Anonymous use a 12-step program identical to the 12-step program set up by Alcoholics Anonymous. Addictive behavior involves a lack of individual control, and these organizations demonstrate the necessity to change their lifestyle and beliefs. Compulsive behavior can be triggered by various factors: genetic predisposition, environmental stress, the repetitive behavior itself. Substance abusers, compulsive gamblers, compulsive overeaters, and compulsive shoppers all show the same dopamine increase in the brain. Compulsive behavior does seem to run in families. Binge overeating has been shown to have a relationship with overactive 5-HT serotonin receptors. Twin studies support the strength of genetic factors leading to obesity. These connections were stronger than shared environmental pressures. Studies of adopted children supported the strength of genetic influences, where such environmental factors as frequency and volume of meals, amount of snack food in the house, and level of exercise was less significant than heredity toward obesity. Researchers have found a marker gene that shows a strong proclivity for addictive behavior, especially alcoholism, and that's, of course, DRD2A1 allele. It appears in only 19 to 21% of non-alcoholics. It appears in 69% of severe alcoholics. It appears in 45% of compulsive overeaters, 48% of smokers, 52% of cocaine addicts, 51% of pathological gamblers, 76% of pathological gamblers with drug problems, 45% of people with Tourette's syndrome, and 49% of children with ADHD, DRD2A1 allele. It is speculated that these individuals, DR2A1 allele gene, have a deficiency of dopamine receptor sites, and therefore they must seek excessive stimulation to force extra dopamine to be released in the reward reinforcement pathway to feel normal. Since their normal is less stimulating, they're constantly bored, stimulation allows them to feel pleasure that they can't feel when they aren't being stimulated. Compulsive gambling may be triggered by the plethora of venues of gamble, state lotteries, poker machines, internet betting, legal off-track betting, casinos on every corner, depending on where you live. Montana's that way. Every gas station has a casino. Nevada, of course, is that way. I don't know about Arizona. I didn't really drive around Arizona very much. Compulsive overeating may be triggered by the plethora of fast food restaurants, lack of daily exercise, physical activity, fats and sugars in the foods that induce craving, parents overfeeding their children, chaotic childhoods that lead people to use food to relieve their depression. And this is a lady sitting on the toilet and eating donuts in an evening dress. Compulsive sexual activity may be triggered by a plethora of sexual situations depicted on television, latchkey kids with no supervision, children with no close emotional family connections, an abundance of internet pornography. Compulsive internet use may be triggered by expanding networks of games, massive multiplayer online role-playing games. Dedicated gamers will play online for an average of 8 hours a day. Expanding networks of online gambling, expanding networks of chat rooms. Compulsive shopping may be triggered by the ease of getting credit, a materialistic view of life. It isn't who you are, but what you have. A barrage of advertisements on television, catalogs that you get just continuously in the mail, 24-hour home shopping networks, internet shopping, internet auction sites. It has been observed that there is a history of emotional, physical, and sexual abuse in the lives of many of the individuals who suffer from compulsive behaviors. Engaging in behavior can lead to compulsive behavior. A big payday when gambling. Eater takes an excess sugars and fats and changes the body's chemistry. Now they eat to be happy because they can't be happy unless they've taken in all that fat and sugar. Being able to buy something that the individual wants makes them shop with the anticipation that they will find another coveted item. Participation in ritualized masturbation, compulsive viewing of pornography, or participation in other compulsive sexual behavior will make the individual avoid normal sexual behavior or emotional relationships. Compulsive gambling has skyrocketed in the last decade, with poker tournaments being shown on television and online gambling available. Last year, gambling revenues in the United States only topped $75 billion. Last year, gambling revenues worldwide topped $125 billion. Gamblers Anonymous defines gambling as any betting or wagering for self or others, whether for money or not, no matter how slight or insignificant, whether the outcome is uncertain or depends upon chance or skill, constitutes gambling. Forms of gambling: casino-style gambling, poker, blackjack, craps, roulette, slot machines, video poker machines, horse and dog racing, jai-alai, bingo and raffles, state-run lotteries and keno, sports betting, both legal and illegal, Super Bowl office pools and betting on golf, schoolyard games, lag pennies and flip coins, bar games, liar's dice, stock speculation such as day trading, commodities, and options, and internet gambling, of course. Gambling has been around since the dawn of man. Gambling bones have been found in human habitation sites that date back 40,000 years. This was not an old world phenomenon. Mayan digs have found gambling implements that closely resemble the dice and bones of other civilizations. Along with gambling has come attempts at prohibition. India tried to prohibit gambling in 1000 BC. During the Roman Empire, it was only for aristocracy. Louis IX of France in 1255 tried to prohibit gambling. Henry VIII of England tried to do the same thing. And of course, during the Victorian era in the United States, gambling became something that you didn't do. When I was growing up, gambling was illegal everywhere. And then, even in Las Vegas, you couldn't gamble for money. You could gamble, but you couldn't gamble for money. That was the thought anyway. And then it just kind of exploded around the United States in the 1980s. Of course, by the 1980s, I was grown up. I was in my 30s and 40s. So there you go. Gambling came to the United States with the British, but the corruption and the addictive behavior made the practice unpalatable, and it was banned. While it was banned in the East, as people moved across the Mississippi River, gambling was popular in the Wild West, where you guys are from. Infected by the same corruption and Victorian morality, by 1910, it again was gone. Gambling didn't return until the 1970s. Since then, Atlantic City and Las Vegas have become gambling meccas, and Indian casinos have changed gambling attitudes, bringing in more money than the cities combined. 48 states have some form of gambling. Only Utah and Hawaii have no gambling. Why? Well, Utah there are a lot of Mormons in Utah, and there are also a lot of Mormons in Hawaii, and they don't gamble. So that may be the reason that Utah and Hawaii have no gambling. The only two states in the United States where there's no gambling. It used to be that there were no states that had gambling. Now, when I was growing up, and then in the late 70s, it opened up. Compulsive gambling, like any other addiction, comes in two forms. Problem gambling, gambling behavior that causes problems in an individual's life, either psychologically, physically, sociologically, or vocationally. So problem gambling is one, pathological gambling is the other. Gambling behavior that is persistent and continual and significantly disrupts all aspects of an individual's life. The real difference between problem and pathological gamblers is often time and money. Problem gamblers can't afford to spend as much time and don't have the money to gamble as they want. They average losses of only $3,000 per year. That's problem gamblers. Pathological gamblers spend far more time gambling and average losses of $11,000 a year. The average debt for women entering Gamblers Anonymous, $60,000. The average debt for men entering Gamblers Anonymous, $100,000. Studies show that the problem and pathological gamblers lose 10 to 20 times as much as non-problem gamblers. In a study in Connecticut, 47% of the casino patrons were problem or pathological gamblers, even though they only comprised 5% of the population coming into the casino. In Minnesota in 1993, it was discovered that 2% of the population generated 63% of the state gambling revenues. Harvard Medical School studies estimated that 125 million people in the United States gamble, and that doesn't include me. Remember, I grew up when gambling was illegal, so I didn't develop the habit when I was young. $2,200,000 of these individuals are pathological gamblers. 5,300,000 of these individuals are problem gamblers. This didn't take into account the 1,100,000 adolescent pathological gamblers. Male compulsive gamblers outnumber female compulsive gamblers 2 to 3 times. This may be changing with the increase of casinos and slot machines, as women are more likely to use gambling to escape depression, trauma, or relationship problems. Pathological gamblers tend to have other addictions. 25 to 63% of pathological gamblers have other behavioral or substance addictions. One study found that 73% of pathological gamblers had alcohol problems. The same study found that 38% of pathological gamblers had a drug problem. 60% smoked, 50% had mood disorders, 41% had anxiety disorders, 60% had personality disorders. The group that has seen the greatest rise of gambling is among older adults. One survey of residential and assisted care facilities found that 16% went to casinos at least once a month. This behavior is exacerbated by casino-sponsored trips and day trips, which were found in 2/3 of the facilities. And why go if you're not going to gamble? College students gamble at a higher percentage than any other group. 42% gamble, 26% gamble weekly or more frequently. Heavy college gamblers were more likely to be smokers, heavy drinkers, and or heavy marijuana users. These individuals average lower grades and more frequent absences, as that's a shock, isn't it? Different types of gamblers. There's recreational social gamblers who are able to separate gambling from the rest of their lives. For professional gamblers, their main source of income is gambling, and because of this, they are able and willing to take losses in their business. Antisocial gamblers may steal to gamble and have no conscience about the thievery and corruption that they represent. There are two subtypes of pathological and problem gamblers. Action-seeking gamblers are frenetic, excited, and are always seeking to escape. Escape-seeking gamblers are drawn to gambling machines and are often responsible people with good jobs. But they begin gambling to escape from their emotions or just to escape boredom. The symptoms of persistent recurrent pathological gambling: preoccupation with gambling, of course, reliving past gambling experiences, planning future gambling. I have a friend who gambles all the time. He told me that he won. Let's see, how'd that work? He said, I won $700 last night. I said, really? Because he started out with $100. I know because I gave it to him. I didn't give it to him. He was working for me, and I gave him $100 at the end of the night, and he went right to the casino and started gambling. He said, I won $700 last night. I said, you do? How much do you have left? And he said, well, none. Wait a minute. If you won $700, where's the money? And he said, well, I gambled it away, of course. According to him, just winning was what he was trying to do. It didn't matter how much he had left over. That wasn't the point. The point was getting rid of the money. Anyway, that was my friend. Increasing the amount of money used in gambling, unsuccessful attempts at stopping or curbing gambling, restlessness and irritability when not gambling, using gambling as an escape, chasing, trying to recoup past losses, lying about gambling, financing gambling through illegal acts, jeopardizing your job, your relationship, and education to gamble, expecting others to bail out the gambler's debt. And of course, luckily, this guy was not that kind of guy. He never tried to borrow money from me, but he was willing to put in a good day's work, and I was willing to pay him well for his labors. Winning phase: in the beginning, the bets are small and they're happy just to win or break even. But as recreation becomes compulsion, the reward becomes more the stimulation of the action, and they seek to prolong the action as long as they possibly can. Winning becomes secondary to staying in the game, and that's what my friend did. In 70 to 80% of the cases with compulsive gamblers, the beginning to their craving for gambling started with a big win. The gambler begins spending more time wagering, and their conversations are salted with lionizing their wins, and when mentioned, minimizing their losses. I had to ask him how much money he had left over. He was just bragging about winning $700 at the casino last night. I won $700. He told everybody he won $700 last night. And I think he's probably pretty lucky somebody didn't knock him on the head and checked his pockets to find out how much money he didn't have. Losing phase. The losing phase begins with a losing streak, which is inevitable due to the simple laws of chance. Their large losses are met with larger wagers to try to recoup their previous losses, and this is known as chasing, of course. As the gambler continues to lose, they will dip into depression. They will seek isolation, becoming irritable and lie about their situation. Desperation phase. In the desperation phase, the pathological gambler may lose their job, max out their credit cards, borrow money from friends and family, perhaps turn illegal activities to hide their addiction, theft, embezzlement, drug dealing. The gambler may bankrupt their family and suffer divorce. Giving up phase. In the giving up phase, the gambler is no longer trying to recoup their losses, but they seek the game to stay in the action. 72% of gamblers experience depression when they hit bottom. Suicide attempts occurred in 17 to 24% of these gamblers when bottom was hit. This is usually the time when the gambler seeks treatment after he's $100,000 in debt, or $60,000 if he's a female. For the compulsive gambler, it isn't the money that they're seeking, but the rush from the large win and the zoning out of the gambling that gambling affords them. About 1/3 of compulsive gamblers recover on their own, usually triggered by devastating financial losses. For the other 2/3 who seek treatment, the techniques used include antidepressant therapy, anti-craving drugs such as naltrexone, and Gamblers Anonymous. Compulsive shoppers and hoarders have the same cravings as do gamblers and drug addicts, but in this, the high is caused by the feeling they get when they purchase an item. 74% of the time, compulsive buyers purchase items on impulse. 50% of the household income for these compulsive shoppers goes to paying their shopping debts. 50%. Compulsive shoppers tend to buy items that enhance their sense of uniqueness. Women buy jewelry, clothes, and cosmetics. Men buy high-tech electronics and sporting equipment. Depression seems to be the main impetus behind their compulsive shopping. It seems worse during the winter holidays, so this is the time when they accrue 40% of their debt. Antidepressants reduce the urge to compulsive shop. Collecting, accumulating, and hoarding are offshoots of compulsive shoppers. The individuals gain self-worth and self-esteem from the objects that they own. And let's see if this works. Oops, I gotta get out of there. Whoops, I need to go backwards. Okay. Look, we're almost done. Copy. Not found. Okay, sorry about that. It was about a household of cats. There were about 50 cats in this lady's house. They had remodeled their house to be like a giant, scratch toy. These collectors and hoarders may buy valuable items, contemporary fads, or accumulate valueless items. There are cases of people who are unable to throw away newspapers and magazines. People will also hoard animals, cats, dogs, birds. There was a case in Montana where an individual hoarded goats, and he had like 250 goats, and they were on a 10-acre property, and then he died, and nobody knew about the goats, so nobody was doing anything about the goats, and they all starved to death. I mean, it was really ugly. Another case in Montana, there was a lady that came down from Alaska. She was driving a semi, and they opened up the semi, and this wave of urine and feces stench came, hit them in the face. She had the entire semi trailer full of dogs. She had in cages. They were collies. They were all the same breed of collie. And of course, they took them away from her. But we tried to get one of the collies. We were going to house one of the collies. That was so weird. Oh, there's so many hoarders up in Montana, just crazy. When I was working in Omaha, there was a lawyer that we she a pile of newspapers fell on her one night and it broke her leg, and so we had to go in and get her. And Oh, geez. She had cats and newspapers, and she had newspapers just stacked everywhere, and magazines. I mean, it was talk about a path person. She was a path. I guess I never talked about path people, but she was a path person. You couldn't get through her house, and it was a struggle just to get her out of there because the gurney didn't fit, and we had to take in a handheld. Uh, Litter to get her out, and we had to strap her in and turn her sideways in order to get her out. I mean, it was just horrible. She was a big lady. She weighed well over 200 pounds, and just getting her, navigating her through the path of newspapers, and of course they all stunk because she had so many cats. How much fun was that? Anyway, there you go. Let's get back to talking about something more pleasant. In 1980, 15% of the adult population in the United States were considered obese. By 2005, 33% of the adult United States population were considered obese. Tragically, only 33% of the adult population are of normal weight now. The average height of the United States female is 5'4" with a weight of 164 pounds. The average model in the United States is 5'9" with a weight of 110 pounds. There are 3 eating disorders: anorexia nervosa. I'll tell you what. You know what? I know we're almost done. Let's see. Wait a second. I apologize for this. I should have looked this up before. I'm in the wrong one. I think. Oh, chapter 7. Yeah. Okay. See, I had more pictures in this one, and it's kind of fun. Let's go find some of those pictures. Yeah, I had pictures of all this stuff. There you go. There you go. I grabbed the wrong one. I apologize for that. Toluene. There's Toluene. And huffing. And there you go. There's some trilene and I don't know. TCE is what that is. And butane. And she's sniffing gas. And they're sniffing alcohol. He's huffing something. And those are nitrites, Viagra and poppers. Oh, there they are. This is why. See, I thought I had this. I should have stopped before to find this for you guys. There we go. Oh, this is kind of fun. He's. There you go. All right. Feeling good. There you go. Sorry, that's Vicodin and Carisoprodol. Celebrex. Uh-oh. Whoa. Of course, it doesn't quite work that way. And there's an asthma. Leonard has asthma. And now we're talking about ergogenic drugs. These are some of the bodybuilders. There they come. Just massive guys. Just massive guys. Just massive guys. Yeah, checking out the mirror. That's what mirrors are for. There you go. Oh, that's the acne I was talking about. Yeah. So you get it on your shoulders. You get it on your back especially. This guy's got it on his chest and on his shoulders. Takes too many steroids. And there's there's him again. Oh, there's some women before and after pictures. Before steroids and after steroids. before steroids and after steroids. She's in pretty good shape on the left. I didn't think she needed to do that. There you go. And their hair thins, as weird as that is. Kind of cute on the left, not so much on the right. Kind of cute on the left, not so much on the right. There we go. Blood dope, caffeine, Ma Huang. This individual died. He was a pitcher for the Cleveland Indians, or the Guardians now, but he died of on the mound actually from ephedra. And there we go. Ryan Braun took human growth hormone. He has retired from baseball now, but he had taken human growth hormone and was banned from baseball for like 180 days or something. Beta blockers with erythropoietin, using his own blood. What is this? Creatine. Yeah. Yeah. It accelerates the recovery so that you can lift every day. What's he doing? Oh, GHB. He's going to poison somebody's drink. And there's anorexia or bulimia for some reason. Soybean pollen. I'm sorry, bee pollen. Mega B15. Practin. Geez, I'm a goofball. Yeah, there we go. Chewing dandelion roots. This looks hungry, doesn't she? Embalming fluid. There's your bufo toad. So if you ever see one of these guys, just, you know. Fountain of Youth. Neurotropics. There's some more of them. Shine. Celogeline hydrochloride. Compulsive hair pulling. Checking things. Always washing his hands. Okay. Orphans. These are orphans. I can't remember why I was talking about orphans. Yeah, eating, sex, okay, shoppers. Oh, that's, anyway. Gamblers, drinkers, stealing, winning, Desperation Phase, compulsive shoppers. Oh, hoarders. I've got some pictures of hoarders. Just one, I guess. Here. This is what I wanted to show you guys, and this is the reason I went to this. This is what a normal average woman in the United States, 5'6". That's not right. 5'4", wasn't she? 5'4", 164 pounds. That's what 5'4", 164 pounds looks like. That's what 5'10". Is that what it was? 5'9". 5'9", 110 pounds. You can see they don't look anything alike. And there's the same thing. 164 pounds, 5'4", and that's 5'9", 110 pounds. Almost anorexic. And there we go again. 164 pounds on the left, 110 pounds on the right. Tall person on the right, a shorter person on the left. And there we go. Okay, that's what I wanted to show you. Okay, so let's go ahead and finish this thing up. There are 3 eating disorders: anorexia nervosa, body image distortion, and an addiction to lose weight. Bulimia nervosa, eating excessive amounts of food and then controlling weight by purging, vomiting, fasting, or excessive exercise. Binge eating disorder, eating excessive amounts of food with no attempt at weight control. That's what this is, binge eating. Compulsive eaters feel powerless when dealing with food. These individuals tend to be obsessed with food. They use food to escape undesirable feelings such as boredom and depression. They have secretive behavior like eating in the bathroom. They feel guilt. They're in denial about their problem. They continue to overeat, the overeating behavior despite the harm that they're doing to themselves. Eating disorders seem to be a combination of genetic, neurochemical, psychological development, and sociocultural factors. 9.3% of the U.S. adult population is diabetic. That's 19,300,000 people. 26% of the U.S. adult population are at risk for diabetes. That's 54 million people. 15.5% of American Indian adults have diabetes. 10% of African American adults have diabetes. 6.5% of Mexican American adults have diabetes. And 5.6% of white adults have diabetes. It is not uncommon for someone with an eating disorder to have a co-occurring disorder as well. 12 to 18% of anorexics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. 30 to 70% of bulimics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. This is Kaylee Cuoco, and the reason I have Kaylee Cuoco up here is because when she was first started on The Big Bang Theory, she had an addiction to a nasal spray. The nasal spray, what is that stuff? Anyway, it's used by the Air. It was used by the Air Force so that pilots who had colds could still fly. That was the idea. And so what it did, it cleared your sinuses. And since she had this fear of sounding like she had a cold, she would spray this stuff all the time. Well, you can't do that with this stuff. It's got alcohol in it, and it burns your nasal passages. So she was having problems with bleeding and whatnot. But she did this for like 2 or 3 years, and then she stopped. The other reason I have the picture of her is because she's pregnant now. No, that's not the reason. That just happened a couple days ago. She just announced it a couple days ago. I won't say that she got pregnant a couple days ago. Anyway, Kaylee Cuoco. Most eating disorders begin during adolescence. They tend to be chronic and affect women more than men. 3% of women suffer from one of the three eating disorders. In high school, 33% of girls and 16% of boys show symptoms of one of the eating disorders. This is a picture of Snooki. Whoops, I'm sorry. This is a picture of Snooki when she was in high school. As you can see, she wasn't the chubby girl that she was in Jersey Shore. She was fairly anorexic. She was a cheerleader, but she was fairly anorexic. And there she is. There she is on from Jersey Shore, and this is her after Jersey Shore stopped. She stopped eating again. Now she's a family. She's had a couple of babies, and she doesn't look like this anymore. But this is Snooki when she was on Jersey Shore. This is her when she was in high school, and of course this looked more like what she looked like in high school when she was anorexic. One of the frightening statistics dealing with anorexia is that the age of onset has dropped from 13 years to 9 years. My grandson is 10, so these are girls in his 5th grade class, and maybe the 4th grade class. 3rd grade girls are starting to diet and starve themselves to look thin. They start talking about a thigh gap. A thigh gap means that when you put your feet together, there's a gap between your thighs. That's not the way it's supposed to be. Your thighs are supposed to touch each other when you put your feet together. If you have your feet that close to each other, they're not supposed to look like this. She's so proud of herself because of her thigh gap. Anorexics seem to have a fear of gaining weight. These individuals tend to have a tendency to perfectionism and a low self-esteem. Death rates for anorexics range from 4 to 20%. Bulimia nervosa is a disorder characterized by binge eating and the obsessively ridding oneself of the food that has been eaten. Vomiting, laxatives, diuretics, excessive exercise, this is the way they control their weight. Bulimia actually means ox hunger, as in hungry enough to eat an ox. When binging, these individuals eat as if they were famished to the point of uncomfortably distending their stomachs. These individuals are notorious for eating and purging in secret. A bulimic will often have secret stashes of forbidden food stashed away throughout the house that they can eat in private and purge quickly. Much of the cause of bulimia in particular and eating disorders in general stems from perceptions of acceptable appearance for females on television. When television was introduced to Fiji, 3% of women on the island vomited to stay slender. 3 years later, the percentage of vomiters had increased 5 times to 15%. Fashion models maintain a body weight 13 to 19% below the women that they are modeling the clothes for. And there you go. If that lady isn't anorexic, I'm not sure what anorexia is. While binging and purging may occur millions of times a week around the United States, it is not without its negative effects. Dental complications, greater possibility of alcohol abuse, greater possibility of drug abuse, high rates of depression, greater risk of suicide, stomach acid burns to the esophagus and throat, loss of tooth enamel, heart problems, arrhythmias, menstrual problems, and electrolyte imbalances. The reality is that in order to ovulate, a woman must maintain at least 10% body fat. And if she goes below that, her periods will stop. And of course, this is a problem that anorexics have and that some bulimics have. Binge eating disorder has become an international problem. For the first time in history of humanity, there are as many people in the world who are overweight as those who are underweight. In the United States, where obesity is defined as more than 30 pounds over one's ideal weight, obesity has increased from 15% in 1980 to 33% in 2005. Binge eating disorder affects 4.6% of the population at large. Binge eating is eating until the individual is uncomfortably full. People tend to be eating in response to emotional states rather than to true hunger signals. These individuals tend to have frequent episodes of eating large quantities of food, feeling a lack of control where food is concerned, eating rapidly and swallowing food without chewing, eating despite being uncomfortably full, eating when not feeling hungry, eating away from others so that they won't see your volume of intake, feeling disgusted because of the lack of control of food, and having a preference for high carbohydrates and foods with high fat content, junk food. Binge and compulsive eaters do not seem to know how to pace themselves, eating rapidly and in massive amounts until they feel painfully uncomfortable. Such eating may be done to control anxiety. Food seems to have a calming and sedating effect on some people. Adolescents who eat when they are depressed are twice as likely to suffer from obesity or bulimia. They are also twice as likely to suffer from anorexia. Compulsive overeaters are more likely to suffer from high blood pressure, high cholesterol, circulatory problems, heart disease, type 2 diabetes. There are 15 million Americans with type 2 diabetes, sleep apnea, gallbladder disease, gout, arthritis, 15 to 60% greater risk of cancer, exhibit high rates of depression, become distressed and develop a negative body image, allow their self-esteem to suffer badly. Sexual addiction is marked by sexual behavior that the individual has little control over and little choice. This type of behavior might be practiced by young or old, gay or straight, male or female. The addiction not only includes sexual contact with another individual, but arousal through masturbation, viewing pornography, serial affairs, phone sex, visits to topless bars, and visits to strip shows. Sometimes sexual addiction can involve illegal activities such as prostitution, sexual harassment, sexual abuse, exhibitionism, child molestation, rape, or incest. By 2007, there were over 4 million pornographic sites on the internet. 40 million Americans visit these sites regularly. What was it? What did I read? 30 million people view Pornhub every hour, 24 hours a day, 7 days a week. 30 million people. 70% of the visits are during work hours. 10% of the people surfing the porno sites are addicted to online pornography and spend up to 8 hours a day viewing sexual material. Worldwide, the pornography industry clears $57 billion a year. In the United States, the pornographic industry clears $12 billion a year. Much of the pornography is filmed and photographed in the San Fernando Valley outside of Los Angeles, also known as the Valley. 3 to 6% of the U.S. population are sex addicts. 80% of sex addicts are male. Sexual addiction usually starts in the teen years and then peaks between ages 20 to 40, after which it slowly declines. Sexual addicts seem to suffer from other addictions in conjunction with the sexual problem. The DSM-5 identifies several paraphilias: exhibitionism, fetishism, voyeurism, which is rubbing up against somebody, getting sexual gratification from rubbing up against somebody like in a subway or something. Pedophilia, sexual masochism, sexual sadism, transvestic fetishism, which is dressing up like the opposite sex, and voyeurism. Now, dressing up like the opposite sex and not getting any sexual gratification in it is not transvestic fetishism. Only if you dress up to get you're sexually excited. Other sexual addictions include love addiction, the desire to fall in love and be in love; relationship addiction, the need to be in a relationship with an individual, may mean maintaining multiple relationships at any one time. Individuals suffering from any sexual addiction maintain little, if any, control over their behavior despite adverse consequences. The individual will continue to obsess over the behavior to the distraction of everything else. Compulsive sexual behavior is repeated because of the release of the pleasure-inducing neurotransmitters, dopamine, enkephalin, and endorphins. Tolerance to these neurotransmitters leads to a need for the addict to spend more and more time in their sexual activity to gain the same mental benefits. Damage can be done to careers, relationships, self-image, and peace of mind. The sexual addiction becomes the driving force in the addict's life. Part of the drive for the addict may be the risk that they are taking to achieve their target behavior. Usually the addict will culminate the behavior through orgasm, though in some cases it may involve exposure or fondling. The trigger behavior is often followed by remorse, guilt, fear of discovery, resolution to stop the behavior. The sexual behavior is often pursued with a sense of desperation, self-loathing, despair, and low self-image. Internet addicts seem to have no control over the need to log on. While the internet didn't really begin until 1993, today 4.5 billion people worldwide out of 7 billion are connected to the internet. 15 to 20% of the 100 billion or 1 billion have high-speed connections. In Canada and the United States, 90% of the populations are connected to the internet. The three main uses of the internet are gaming, seeking erotic material, and gambling. The internet is anonymous, it's inexpensive, it's controlled by the user, it's validating, rewarding, convenient, and it's escapist. Logging on at every chance at home or work, non-addicts log on an average of 8 hours a week. Addicts may log on 40-plus hours a week, obsessing about the internet, feeling irritable and anxious when not online. Time online increases to make the individual feel that they have had enough. Losing track of time when online, neglecting responsibilities to be online, allowing relationships to deteriorate with spouses, coworkers, family, and friends, posting more messages and downloading more and more data, eating in front of the monitor, checking email frequently, more than once a day, and actually working here And teaching online, I looked at my how many hours a day I was spending on the computer. Over 11 hours a day, and I have to check my email relatively frequently because I'm an advisor, so that's my excuse. Some internet addicts seek oblivion, wanting to zone out, while others seek frequent or constant interaction. Physical symptoms of internet overuse include blurred vision, chronic lack of sleep, twitching mouse fingers, relationship problems. And of course, I'm on an Apple, so I can't have a twitching mouse finger. The list of internet addictions includes cybersexual addiction, computer relationship addiction, internet compulsions, information addiction, computer games addiction. And actually, I'm teaching all this stuff this semester in a class called Cinema Therapy, Social Media, and Alternative Platforms. The alternative platforms are all the gaming platforms. Computer relationship addiction entails individuals dealing more and more in their online fantasy world. They pull more and more away from their real relationship until they lose them. Eventually, the addict's cyber world replaces and becomes the most important aspect of their life. For online gamers, the game might start offline, and then as they improve, they need the competition of the online games. Like any other online addiction, gamers lose track of time while they are playing. Some gamers will spend every free moment gaming. Men, teenagers, and children play online more than any other groups. Whereas non-addicts will spend 20 to 60 minutes playing a game, a gamer will average 6 hours a day in their games. For the last 60 years, the most frightening non-substance addiction was television addiction. TV addicts may easily spend 6 to 8 hours a day watching. 60% of American homes contain 3 or more televisions. In many American homes, the television is on longer than their lights are on. The benchmarks for TV addiction: compulsive use, making the individual a couch potato; using television to change one's mood, sedative or antidepressant; craving use, loss of control, continued use despite adverse consequences, development of tolerance. The average adolescent watches TV for 1,500 hours a year as compared to 900 hours of school. The shows that an addict watches skews how they see reality and leads them to make more poor decisions. Since television shows dysfunction as normal, adolescents have a hard time accepting their own culture as real. Commercials for fast food may lead to compulsive fatty food consumption. News focuses on negative events leads to the individual to skew towards seeing the world as an especially dangerous place. A study in New Zealand showed that the more the child watched television between 5 and 15, the less likely they were to graduate from high school or go to college. And this, of course, is New Zealand down here. This is Australia, and this is this is Tasmania. That's a joke. There are over 260 million cell phone users in the United States. There are over 6 billion cell phone users around the world. Calling and texting takes up a large part of a teenager's day, to the exclusion of studying or engaging in face-to-face relationships. And that is the end of the chapter. It is this chapter that convinced me that I needed to start teaching a class called Cinema Therapy, which is what the class was called before, but to talk about social media and gaming. And so that's the reason I've done that. I need to stop right now because I've been on here too long.